Since March of 2020, countries around the world have closed their borders, jeopardizing the ability of the United Nations to deliver on its mandates. To resolve this fundamental problem, the UN MEDEVAC Task Force originated to benefit the entire UN system by ensuring a high standard of care, safety, and health for all UN personnel, dependents, and its implementing partners. The task force is comprised of 11 UN entities and the UN Medical Directors Network.
This task force is unique, innovative, and refreshingly unbureaucratic. All members of the task force contribute budgetary resources, and all staff involved have worked relentlessly as one team to achieve a joint goal.
The MEDEVAC mechanism covers regions including Asia, Latin America, Africa, and the Middle East, and a network of over 130 trained COVID-19 coordinators exists on the ground, coordinated by the MEDEVAC cell in Geneva, which is comprised of dedicated medical and aviation experts. All UN personnel and eligible partners in need of medical evacuation now have access to a well-established mechanism. The process starts with a local COVID-19 coordinator who assists and coordinates with local doctors. Once a case is initiated, the medical cell confirms the clinical need for the MEDEVAC, identifies a bed in one of the pre-arranged UN-approved medical facilities, arranges an international flight, and the patient is transported to a facility in a fully equipped aircraft staffed by medical personnel. Once the patient is hospitalized, they receive a high level of life-saving care funded by the MEDEVAC Task Force cost-share arrangements. Hospitals have been contracted or built from the ground up, offering global coverage for UN personnel and partners, and also providing resources for the future.
Seeing that success of someone who was brought in an air ambulance, going back well recovered, I think this is the greatest satisfaction that a doctor can get.
The MEDEVAC Task Force serves as an example of a successful One UN partnership with extraordinary cooperation among numerous system entities to design, resource, and implement a framework. This is a model that can and should be leveraged in the future